want to do research on these particular things, they avoid them because it could be incredibly damaging to their careers.
And it's bureaucratic. I mean, there was a group at Columbia that was doing really fascinating research on the drug Ibogain and Parkinson's disease. And I was speaking with the head of this study, and he was saying how obnoxious it was to have the government come and weigh his vial of Ibogain every day and monitor his logs. And, you know, this guy is a really serious researcher. He's not going to, if you were to get high, he's not going to get high off this tiny supply of government mandated or government-sanctioned Ibogain that was supplied to him. But they give these people a really hard time. They make them buy a very expensive safe. They do all this stuff that these are the last people to abuse the substances. And they are the ones that are hurt the most severely, except for, of course, the people that go to prison. They're the ones that are hurt the most severely. Yeah,
it's a crazy thing to think that people are going to recreationally use Ibogain. That's one of the weirder ones.
Oh, it's totally bizarre. Yeah, and Ibogain is a drug with so much potential. For those people that are aware of Ibogain, it's typically only discussed as a drug that treats addiction to opioids, which is very, very important, especially now. But that's the tip of the iceberg with Ibogain. It has one of the most complex pharmacologies of any drug I've ever studied. There's almost nothing it does not do. I mean, it's, you know, you have the alpha-3 beta-4 nicotinic acetylcholine receptor, which is also the target of Wellbutrin and has a kind of smoking cessation anti-addictive effect. Then you have really high affinity relative to the other receptors for the NMDA receptor, so it has a ketamine type effect. Then it has a classical psychedelic effect at the 5-HT2A receptor. Then it's a dopamine reuptake inhibitor, serotonin reuptake inhibitor. It just goes on, and then it releases this protein, GDNF, which is considered one of the most important proteins in treatment of Parkinson's disease. It's one of the only things that is able to cause regrowth of dopaminergic neurons in people that have Parkinson's. So this is like really fascinating stuff that's just in Schedule 1. Scientists can't work with it. It's a tragedy.
It is a tragedy. And it's also so effective. I know so many people that have gone to Mexico and gone to these clinics and done one Ibogain session for 24 hours and come out of it a totally different person. Come out of it with a complete new perspective on even why they were using whatever they were using in the first place in a way that they didn't. Not only does it help eliminate the addictive properties and the connection that your body has to those substances, but it also allows you to re-examine why you went down that road in the first place.
Yeah. Oh, yeah. And there, you know, there was a sort of pharmaceutical push to develop non-psychedelic derivatives of Ibogain that would retain the anti-addictive properties, which sounds like a good idea in theory. But so they created this drug called 18-MC, and it wasn't psychedelic, but then it also lacked some of these neurotrophic factor releasing properties of Ibogain. But really the bottom line is that we shouldn't deny the fact that the psychedelic activity of these substances is therapeutic, psychotherapeutic in and of itself. You know, I had a friend who was severely, severely addicted to heroin, and he traveled to the Netherlands to take Ibogain and, you know, took the drug, was going into the experience, and then started feeling this intense craving for heroin, and started looking through his bags to see if he'd somehow had forgotten about a little bit of heroin that could just get him through the day. And then he goes into his bag and then finds a small bag of heroin and snorts it, and then is like, I traveled all the way to the Netherlands to do this. I'm a failure. I'm relapsing after all this money, all this work. I have no self-control. I'm a terrible, terrible person. Why can't I just stop? And then realize that the whole thing was a hallucination. There was no heroin. He'd hallucinated his own relapse.
Whoa. Wow. What was your experience with Ibogain?
I've never taken high doses. The most I've ever taken is 50 milligrams of
What's an effective dose?
It really depends. There's a sort of move toward microdosing Ibogain because it actually does have a cardiotoxic effect, especially at higher doses. So people are looking into ways of reducing that cardiotoxicity by using it at lower doses for longer periods of time. Again, this is something that has to do with prohibition, because in this prohibition market, if you are addicted to heroin, you go to Mexico or you go to Canada, and you go to an Ibogaine clinic, you need to get as much bang for your buck as quickly as possible. You're not going to stay there for 2 months of treatment because most people have lives and can't afford to do that. So what do? They give you what is called a flood dose. It's a massive dose, often a multi-gram dose of Ibogaine, because it's just like a sledgehammer that knocks you down and allows you to get out of it. But is that the best way? That's the fastest way. That's the most appetizing way for someone that had to travel to do it. But is it the best? Probably not, because we know that at high doses, it has this potential to induce cardiac arrhythmias, and that can kill and has killed. So people are, now looking at lower doses over longer periods of time, which would be ideal if it were legal in the United States, I believe.
Yeah, it's a really interesting